Welcome to the GMJ Podcast, the official podcast of the Georgian Medical Journal. In this series, we present structured discussions of peer-reviewed contributions published in GMJ, examining their implications for clinical practice, medical education, and health policy. This episode reviews the article titled, "A New Voice in Georgian Medicine, Launching the Georgian Medical Journal, GMJ."
So before we jump into the specific mechanics of this launch, imagine having a critical piece of a global medical puzzle.
Right.
You want to share it, but you're not allowed in the room because you simply cannot afford the cover charge. I mean, that is essentially the structural barrier we are unpacking today for you, the listener.
Exactly, yeah. We are looking at an initiative designed to basically tear down that exact barrier. I mean, the central thesis here is the establishment of the GMJ as an independent academic platform. The primary goal is to amplify the scientific voice of Georgian medicine and actively integrate it into the global health discourse.
Rather than leaving it isolated. Right, exactly. Addressing those structural barriers that limit international visibility for, locally generated scientific evidence.
And this whole initiative, it actually stems from discussions at the October 2025 European Union of Medical Specialists.
The UEMS.
Right, the UEMS Autumn Council meeting in Tbilisi. But I want to drill down into the why here. We constantly hear about these localized structural barriers, specifically high article processing charges, or APCs.
Oh, definitely.
How do these fees mechanically isolate national research from international databases? Because, well, it seems counterintuitive to global science.
It does. Think of international research databases like a highly exclusive conference.
Okay.
Even if a researcher in Georgia has, say, groundbreaking clinical data, if they cannot pay the thousands of dollars in APCs to get published in an index journal, well, their work just stays outside the building.
Wow, yeah.
And when you combine those steep fees with limited institutional funding and restricted access for early career researchers, you get a systemic silo effect.
Wait, so you are telling me incredibly relevant clinical data is just sitting locally because of a paywall?
Essentially, yeah.
That seems like a massive blind spot. I mean, if global health policy is shaped without this regional data, then the global consensus we rely on is actually incomplete.
That is the critical realization here. You cannot have a truly global consensus when entire regions are missing from the literature.
Right.
To counter this, the editorial outlines a very straightforward strategic intervention. The new journal is completely waiving submission and publication fees during its initial years.
Oh, wow. So removing that financial barrier just gets them in the door right away?
Precisely. It is a financially inclusive model that basically guarantees participation from those who were, previously priced out.
But once they are in the door, what exactly is this platform looking to publish? You need a clear structure to make a lasting impact.
Absolutely. The structural priorities are highly focused. The journal prioritizes peer-reviewed public health and medical research.
Okay, so a clear scope.
Yes. But beyond just publishing data, it is built to actively support early career academic development and foster international scientific collaboration. It is really about building a sustainable infrastructure for these researchers to connect globally.
Which brings us to how this actually changes things on the ground for you, the listener, whether you are a clinician or a policymaker. How does the creation of this specific publishing platform directly influence a national health system?
Well, by creating a highly visible open access pipeline. When local public health data and medical research are rigorously peer-reviewed and freely accessible, you establish a solid empirical foundation.
Right, the evidence base.
Exactly. That foundation is what doctors use for evidence-based clinical practice, and it is what governments use to refine regional healthcare policy. It turns isolated data into actionable health strategies.
That makes perfect sense. I mean, it is classic knowledge translation, but the editorial makes a point that establishing the journal is really only one piece of the puzzle.
Right, it's just the first step.
Yeah, you need complementary tools, much like this very deep dive, to bridge the gap between academia and the clinic.
Because rigorous data only matters if people actually read and understand it.
Right.
Integrating Georgian science into the broader European and global community requires multi-channel dissemination. Academic publication provides the vetted data.
But you need more than just the publication.
Exactly. Active communication strategies ensure that research actually reaches the practitioners and policymakers who need it.
It forces us to look at the entire ecosystem of how medical knowledge is shared.
It does. And it leaves you with an interesting question to consider.
Oh.
Yeah, if national journals systematically begin waiving publication fees, will we see the geographic center of global health research fundamentally shift in the coming decade?
Thank you for listening to the GMJ Podcast. For a full and detailed discussion of the topic presented in this episode, we invite you to consult the original article published in the Georgian Medical Journal. A direct link is provided in the episode description. We look forward to continuing these scholarly discussions in future episodes.